Hi everyone, welcome back to my channel, Coloring and Comments, a channel where I color in mandalas and talk to you about various topics that are on my mind. And today is going to be somewhat different from what we usually do, in the sense that we will be having a look at something that has been plaguing my timeline this whole week. And I decided, let's do a live for once. We'll do a live, we'll talk about it. And if you haven't seen it yet, it's a very interesting story. It's the story of a TikToker that fell in love with her psychiatrist, and I'm trying to be objective. Okay, I'm trying to be objective. We'll see how it goes, but we shall stop every now and then to discuss some of the things that she's talking about. But as we listen and discuss, I'll also be coloring in the background. Make sure you drop your comments in the comment section. I will definitely see it and have a read. So, yeah, let's kick off things and see what Miss Ma'am has to say.
I fell in love with my psychiatrist, and he knew, and he kept me until I had the strength to leave after 4 years. Here it is, part one. So I decided to go back on ADHD meds after many years of being off of them. I was on them in my early 20s to help me get through college. And then I went off of them because they just weren't, like, the side effects were too much over the benefits. But then in my late 20s, I read this book, Taking Charge of Adult ADHD, and it absolutely changed my life. For my fellow ADHDers, there's so many good things in here. And the biggest thing that I took away was that it's very important for ADHDers to be on meds. So I decided to make an appointment with a psychiatrist. I just Googled psychiatrist.
So, I'm just quickly going to stop here, right? Uh, Two things that I have to mention. First of all, I have to give credit to the original YouTuber. I'll make sure to link that channel in the description below, because I don't have TikTok, okay? So I watch everything from TikTok on YouTube. So make sure to link their channel below so that you can have a look at their channel as well and show them some love. Second thing, which is now getting into the video, is I always advocate for people to deal with their mental health in the best way possible and in a way that suits them. One thing she did talk about is being on medication, and I know a lot of people. Let me not say a lot of people. Let me not generalize, but there are people that are against medication. So I just wanted to stop here and say that if you are one of those people that need medication in order to manage your mental illness, it is totally okay. I say take your medication, be safe, be stable, and for the people that want to judge, let them judge. Okay, they're not in your shoes. But yeah, let's continue to listen to her story.
Psychiatry in the city that I lived in, and I went with the first one that came up, and I got an appointment within a month. And then I booked a 90-minute intake, and I show up to the intake, and this man is my age, and I can't help but notice that he's pretty attractive, this psychiatrist. And he kept me anyway, part two. So in this intake, I kind of clocked that he was attractive in my age, but when I tell you that I've had a lot of couch time in my life, a lot of therapy, I just went right into it. I trusted him enough, of course, why wouldn't I, to tell him about my childhood trauma, my daddy issues, if you will, what I had went through, all of the relationship trauma that I had. I was 6 months sober at this time, but like all of the drinking and substance use I used to do. And he just listened and nodded. And that's the thing about psychiatrists, is that they're good at pretending to listen. They can appear connected, but that doesn't mean that they're always connected. So I just felt really seen.
So I have to quickly stop her here. So she talks about how psychiatrists pretend to listen, but they don't actually. And as a fellow person that has had a lot of couch time, like she puts it, psychiatrists do listen, unless obviously you end up with a psychiatrist that doesn't take their job seriously. But if you are sitting in front of a good psychiatrist, they are listening, and they are listening because they're supposed to be able to diagnose you with what could be wrong, number one. And number two, they're supposed to be able to give you medication that will assist you in getting better with whatever they have diagnosed you with. So it's very important that the psychiatrist that you are seeing listens to you and takes you seriously. So if you find yourself sitting in front of a psychiatrist that doesn't take you seriously, it's time to find another psychiatrist.
And I also told him, I was like, look, I don't want to be on stimulant meds. So he listened to me and he put me on the non-stimulant ADHD med at the lowest dose just to figure out if it was going to work for me.
Part 3. So I hadn't ever seen a psychiatrist before. When I was on meds in my early 20s, I only got meds from my primary care physician. So I didn't.
Okay, another thing. And I'm so sorry if you think I'm stopping too much. Like I said, I'm going to link this in the description box so you can show love to the channel that's sharing this, as well as watch the whole thing and stop without any pauses or without my voice. But I needed to jump in here, and she says she has never seen a psychiatrist before, but she's been on medication. So I understand that different things operate differently in different countries. But from both countries where I've lived in, only psychiatrists can prescribe you medication. And this is because psychiatrists, at least from where I am from and where I currently stay, psychiatrists are the ones that can give you an official diagnosis. And because psychiatrists are medical doctors, right, they are in a better position to know what medication will interact accordingly in order to bring you to some form of equilibrium with whatever condition that you are living with. And psychologists, on the other hand, or therapists, are just there to help you navigate the issues or stumbling blocks that may contribute to your mental illness. And general practitioners, right, are doctors that are not qualified in the mental health space. So usually they perform a more supportive role to psychiatrists. So they'll also prescribe you medication that already exists from your psychiatrist. And this is only from obviously where I've lived. I don't know how it is like in America, but in the system that I have been in, that makes more sense because a GP or general practitioner often does not have the level of speciality that a psychiatrist has in terms of medication dosages and the impact that it may have on a patient.
Understand how psychiatry works. So because he was figuring out my med dose, I saw him every month, and he just made me feel like I was his friend. He was really, really funny and cracked jokes and told me he was impressed with my running that I would do. And yeah, so of course I loved the attention that I got from him. And it was in my 3rd session with him, because at this point we were all on Zoom, that I asked him, I said, "Hey, do you mind if I call you by your first name?" And he's Pakistani, so I said his first name wrong. And he said, "Well, it's pronounced this, but yes, of course you can." And he seemed so smug and happy with himself. And I know that that is because that was his first sign that him pretending like we're friends was working. And to be fair to me, I had only ever been to therapy before. I didn't realize that, it's important to call your doctor last name. I mean, I did know that. I did it with all my other doctors, but it just showed that the boundaries were blurring.
Okay, so it's not important to call your doctor by doctor whoever. It's always the preference of the medical practitioner. Obviously, some people feel it's better for you to refer to them as Dr. So and so because it maintains the professional boundaries. But again, it's up to the doctor and obviously up to the patient. And something to also highlight is that most doctors would want you to feel comfortable. So they'll ask you to refer to them in a way that is most comfortable to you. Obviously, if it's still respectful, because they're still building that relationship with you, because they want you to trust them, because it's only through trust will you be able to fully be open to the type of therapy that they are suggesting.
And he liked that. So from then on, from my third session on, I started calling him his first name. And then he just started turning up the volume on us being friendly. And he would ask me, for the first 6 sessions, he asked me after the meds, he said, how's your bowels, bladder, and appetite? And I would say they're all normal. And then he would ask me any thoughts of harm. And apparently that's pretty common for psychiatry to ask those questions. And then on our 6th session, when things were really, the chemistry was starting to be there before, like I didn't realize it. I was like, oh, this man is just friendly. And he said, I have to ask this because it's a special interest of mine, but is there any thoughts of harm? Like I was special to him. And I said, no thoughts of harm. And he didn't ever ask me a clinical question again. He stopped asking me about my bladder, bowels, and appetite, and he stopped asking me about thoughts of harm. So to me, I would just show up and he was like a therapy appointment every month.
So I was seeing him every month and just gaining more and more respect for him because he would just tell me these little things about his successes and all of the cool things that he was doing in his life. And it made me fall for him, honestly. And he was really good at listening. And I mean, he's a Pisces, right? So of course he's going to be there and be able to go deep with my feelings, but that doesn't mean that he wasn't extracting from them. Anyway, so I would beg him to let me see him every week, beg him, because my therapist at the time, he was fine. He wasn't a predator, but he was fine. He just wasn't doing very much for me. And so that therapist retired and I got a new therapist. And this new therapist, who is a 75-year-old woman with a PhD, she was pretty helpful. So I stopped asking my psychiatrist, begging, honestly, to be my therapist and let me see him more, right? Which also should have been a red flag. But then I started focusing on this therapist. However, I would tell the therapist how obsessed I was with my psychiatrist, and she didn't do anything about it. She just was interested. She also loved stories about my dating life.
So here she talks about a couple of things, but one thing that I want to point out is how she mentioned that she talked about her feelings towards the psychiatrist, to her therapist, and the therapist didn't do anything about it. What is important to note about therapy is that the therapist is not there to do anything except be a sounding board and a voice of reason, in the sense that a therapist can walk you through those feelings. A therapist can highlight why those feelings are maybe inappropriate for any given situation. However, a therapist cannot force you to stop I will say fantasizing in this case about being with your psychiatrist. That's just not their job. I don't want to say, I don't know if I should say fortunately or unfortunately, but that's just not their job.
And yeah, she also was getting supply from me in her own way, but that's for another part. So yes, so I got a new therapist who actually helped me. She taught me CBT, EFT, all of these different modalities. And so I went back to just being okay with seeing Irfan once a month while he was giving me these little breadcrumbs of making me feel special, telling me about his professional achievements, telling me about how he's getting international recognition. And it worked. I was really impressed. See me weekly. And that is when the intermittent reinforcement started. Some sessions he'd be warm and kind and wonderful and let me in on little parts of his life and like be vulnerable with me or pretend. Other sessions, he would be cold and clinical and detached. And you know what that did? It made me work harder in our next sessions. It did. And it started the addiction that I had to him. 100%. And he knew exactly what he was doing. This man gives lectures on trauma and attachment theory. He used his psychiatric training to manipulate me and get me hooked. And guess what? It worked. In January of 2024, I was hit by a car turning left as I was going through a green light. And it was the night before my next appointment with my psychiatrist. So I was like, okay, I'll still be able to go to my appointment on Zoom. I'm okay. But I did make an appointment with an urgent care the next day just to get checked out. I had bruising on my abdomen and a perforated eardrum. And the provider at the urgent care said, I do not feel comfortable treating you. You need to seek emergency care now. You may be internally bleeding. But it was 11 o'clock in the morning and my appointment with my psychiatrist was at 2. So I decided that I was going to wait so I could see my psychiatrist and not have to reschedule because I was looking forward to my appointment with him so much. I look back at that time and I'm just like, oh my God, I put my own life under seeing him. I was fully addicted to him at this point. And you know what happened is that I showed up and I told him that I may be internally bleeding and he didn't stop the appointment. He didn't say, you need to take care of yourself. Go get emergency care now. He let me continue and just tell him about how much I loved him and how grateful I was for him. Because that was really what most of our appointments were, is me just like pouring myself out because he was so good at the intermittent reinforcement.
So here, there have been different opinions about what's happening here in terms of the psychiatrist's reaction to her saying that she is unwell. Should the psychiatrist have been like, oh, let's stop the session, please get some help? Or should the psychiatrist have continued in the same way that they did? So, in my opinion, I say my opinion because but in my opinion, it's quite tricky because if I'm listening to her and the manner in which she has already described the relationship in ways where, as an external party, I cannot see any evidence of how the psychiatrist may have led her on to believe that he wanted to be with her. So from that perspective, I ask myself, did she really articulate it in this way? And if she did the psychiatrist believe her? And I say that because, and I'm not a psychologist and definitely not a psychiatrist, but then there are people that have a tendency to exaggerate things that happen in their life. And because they tend to exaggerate things a lot of the time, it's hard for people to determine when they are being serious about any situation. Yes, he's a psychiatrist, but also he's human. And if she did tell him that, look, I had an accident, I'm not feeling well, he should have canceled the appointment, because there's no way someone can, how do I say this? There's no way someone can be there mentally if physically they're unwell. So he should have canceled the appointment if that was indeed the case. Second thing she mentioned is about her pouring herself out, like pouring out all these emotions and all these things that are happening, and her making it seem as though this was his way of tricking her into falling in love with him, is somewhat of a misstatement, because mental health experts are there to listen to you. They are there to hear you spill out your guts and talk about things that you wouldn't talk about with other people in your life. So he wasn't being a predator with allowing her to speak. He was doing his job. And I know she'll talk about this later on, about them having longer sessions and so on. But I know country to country it changes, but from my experience, most psychiatrists sit with patients for about an hour, because you talk about your life because they want to see how you are reacting in everyday situations, because that's how they can then tell, is the medication working? Is your condition getting better or worse? Especially when it comes to people that have been in therapy for a long time. And this is because people that have been in therapy for a long time are good at telling medical or mental health professionals what they want to hear in order for them to get out of a specific situation. So this is why a lot of them just let you talk and talk and talk until, you can't talk anymore, or you feel like you've told them your whole life story.
Yeah, I got some warmth from him that appointment. So that was January 2023. And I also told my therapist about this. She said nothing. See him, that's when he really started turning up the intimacy in our appointments. However, he was really smart and knew the professional lines like the back of his hand. So he would comment on my appearance, but not compliment my appearance. So I would come on screen and he would say, "Oh, you curled your hair." Or I would come on screen and he would say, "Oh, you're wearing glasses." And of course I felt seen and excited that he was noticing these things about me. I didn't realize at this time that he had feelings for me too. I thought I was holding them all by myself. So I was so excited when he noticed my glasses that I ran and showed him my other pair. And he said, "I prefer turtle shell glasses." So even though I usually wear contacts, I'm wearing these turtle shell glasses in these videos because just in case he sees them ever, he'll see me in his favorite glasses. He did tell me he likes the turtle shell. Anyway, it was just inappropriate things like that, little teeny things that he let me in. And all this time, my best friend is an emergency medicine physician. And she told me, she said, "Kendra, one of these days, your psychiatrist," she would use his name, "is going to say, 'I can't be your doctor anymore. I want to be with you. I want to be with you so bad. I can't be your doctor.'"
This part kind of threw me off and left me feeling a bit disappointed, especially since her friend is a medical doctor. Um, simply hearing her story as a third party, obviously I'm not emotionally invested in her well-being in the way a friend would be, but it's very disturbing for for medical professional to say that another medical professional that is in a space to help your friend, you know very well, is suffering from some form of mental illness, will fall in love with them and terminate their professional relationship in order to be with them. Because if anything, you're feeding into that delusion, if I can put it that way. So as a friend, you should be the one to say, actually, I don't think this is going anywhere, or actually, I think you might have to consider finding another psychiatrist that you're not attracted to have a more neutral and objective relationship from your end and not necessarily from the end of the medical professional. But then again, you know, it's up to her at the end of the day if she wants to terminate or not, unless a psychiatrist cuts it off. But as a friend, I don't think that was a good move on her friend's part.
"I'll see you in 2 years." So my best friend, who's a doctor, she picks up on stuff like that. So even she knew that our relationship was crossing boundaries and getting weird. But that became my dream, was for my psychiatrist, I almost use his name, to do that. And I told him about Brianna.
And if it was crossing boundaries, the friend should have reported it and not encouraged her friend to continue seeing this person, knowing that such power dynamics means that the doctor is taking advantage of his patient. The friend should have reported it and not encouraged this whole situation if that was really the case.
Saying that, my best friend, who's the emergency medical doc, I told him that she would tell me that, and he just would be silent. He didn't disagree, but he didn't agree, and that was weaponized neutrality was his favorite game to play, right? He didn't disagree with Brianna telling me that my psychiatrist had feelings for me, but he also didn't say that's inappropriate. Let's change the subject. It was also around this time that I asked my psychiatrist if he had diagnosed me with anything other than ADHD when I had my initial diagnosis. And he said, yeah, I did. I said, oh, what did you diagnose me with? And he said, well, you had a lot of traumatic things happen to you in childhood because of your dad. And so I diagnosed you with other trauma and stressor related disorder. And that was the first little ping that I got of like, that was weird. Why would he keep that from me? I asked my
Okay, so I see that I've already been here for almost 25 minutes. I will wrap this up shortly. I think I'll cap it off at 30 minutes. But her diagnosis is actually really interesting because when I first heard of the story, it made me think about the term. I'm hoping I'm going to say this correctly. Just give me a moment. I think they call it transference, right? Yes, I think that's what they call it. And that's where an individual can misdirect their emotions, or the emotions that they have for someone or had for someone in their childhood is then reflected and directed towards their mental health professional. And it's interesting that she talks about her dad because unfortunately, when it comes to issues with father figures, there's a lot of issues when it comes to loving connections, attraction. I'm trying to figure out the correct way to say it on YouTube without getting demonetized. Um, okay, let me leave the other one. I don't know how to say it. I don't know how to say it correctly, but such issues and how the girl child views the father figure impacts obviously how your relationships may develop for the opposite gender. And if these emotions are obviously unresolved and therefore you are projecting these onto a mental health professional, you could find yourself in this position. Again, I'm not a mental health professional, but it is an interesting diagnosis and something to definitely consider in her story.
like, why wouldn't he tell me that? That seems important. He didn't tell me because he was using that information to manipulate me. He knew I had trauma and stressor disorder. And instead of helping me heal from it and telling me about it, he used it against me. January 2023, at this point, I was full-blown obsessed with my psychiatrist. And my therapist wasn't helping me. My psychiatrist wasn't helping me. He was feeding it. And then I got a boyfriend. And at first, my psychiatrist wasn't really that keen. But then my psychiatrist realized that my boyfriend was a lot like my psychiatrist. And then I started talking to my psychiatrist about my sex life, about tracking my cycle, using the fertility awareness method. And my psychiatrist loved it. He didn't never say, this isn't inappropriate to your care. Let's pivot. Oh, he just let me talk and talk and talk about my sex life. And I didn't get too deep, but about a year and a half in, and I would send my psychiatrist these emails just about how much I liked him and how I was so grateful for him, and put in a bunch of heart emojis. And this is really when he should have transferred my care, but you know, he waited. He liked what I gave him too much. And so even though my boyfriend did not meet my needs, my psychiatrist and my therapist both were like, you have to stay with him. There's nothing wrong with him not meeting your needs. I'm like, okay. And my psychiatrist was like, he's perfect. Don't get wrong with him. And what was perfect about him was he wasn't meeting my needs. So I was still coming to my psychiatrist looking for emotional validation, which he would drip to me slowly. So my therapist, who I didn't know at this time had bad boundaries, but she did, I went to her because my boyfriend and I, after like more than a year together, we started having issues in the bedroom. And so I went to my therapist and she asked me, what does your psychiatrist think about this? And I said, I don't know. I haven't talked to my psychiatrist about this stuff because I have a crush on my psychiatrist and I don't want to tell him this intimate of stuff. And she said, well, you should tell him because I want a male's perspective. So at my next appointment with my psychiatrist, I told him, I said, today we're going to talk about my intimate life.
And he said, oh. I said, yes. My psychologist, my therapist, asked what your opinion on it was. And I told her that I don't talk to you about this intimate stuff because I have a crush on you. And he looked down and smiled so big in that moment. He smiled so big. And I loved it. It's so gross thinking about it. And then I proceeded to give him 30 minutes of non-stop content about my intimate life with my boyfriend. And I actually recorded the whole thing because I was so excited about it. But now it makes me sick. I can't even listen to the recording. I've tried to start, but it's gross. Any ethical psychiatrist would have stopped me and said, Kendra, let's talk about your meds. Let's talk about your care. At this point, my meds were stable. And I was still seeing him every month. Yeah, that was a rough time. And it was pretty much his Christmas morning, the almost 2.5 years of grooming me to get me to talk about sexual things with him worked. And he got 30 minutes of nonstop content to use. Things. One,
I think this is a good place to stop for the evening. And I say that because we're going to start. I don't mean to laugh, but sometimes that's what I have to do to cope in situations where there's a serious mental health instance happening and I just don't know how to articulate myself. But this is the part I'm stopping here because this is the part we're going to get into. I believe she calls him Henry. And if you don't know who Henry is, we'll talk about Henry tomorrow. So that's why I want us to stop here today. But before we finish off, what I do think is important to say is that if she did indeed tell her psychiatrist that she had feelings for him, and if she did tell her psychiatrist, you'll see as we go along other schmexual stuff, then he should have terminated the relationship with her. However, something to consider is that it's not always easy to terminate a relationship with a patient. And that's not because the doctor doesn't want to terminate the relationship, but also the fact that the doctor has to consider the impact of termination or the impact that termination will have on the patient's mental health. So if they feel as though terminating might push the patient to the edge, they will not terminate. What they often start doing is finding ways to open up discussion, to see other professionals, and how that may help. Another thing that I also wanted to point out real quick before we wrap up is the psychiatrist was encouraging the relationship with the said boyfriend, right? And I think the psychiatrist was encouraging this because he had picked up on the fact that she had feelings for him, I think through the emails, like she mentioned, she was sharing, and perhaps the type of wording and the type of body language she was exhibiting during the sessions. So, um, perhaps he was pushing her to the boyfriend for her to develop a more closer connection with the boyfriend, and therefore for her to feel less attached to the psychiatrist, so that when she comes to appointments, it's her working through and dealing with her mental illness rather than continuing the attachment to the psychiatrist. Yeah. So, yes, that's where we'll wrap up for today. Thank you so much, everyone, for joining me. We'll definitely do this again tomorrow. Tomorrow, we're getting into Henry. I think we'll also get to the point where she's having her dreams. Um, I mean, the original video, the compilation is about an hour long, and we're only 15 minutes in. So, it's still a ride. But like I said, I will make sure to link the full video in the description box in case you want to watch it before we catch up again tomorrow. And if you can't watch it don't worry, we'll watch it together and we'll discuss some more. So make sure to like, comment, share, and subscribe. May your day be colorful and wonderful, and I will see you in the next one.